Hello and welcome to today's presentation. Today we'll be discussing disease-related and societal-related malnutrition, their definition, and how they differ from each other. I'll be your host today. My name is Sam Gunny, and I look forward to presenting this. So, to move forward, we have to have a base to work with, and that would be a definition to go off of for what malnutrition is. And a basic answer would be that malnutrition is an imbalance in nutrient intake which results in undernourishment or overnourishment. In the case of undernourishment, an individual is not consuming an adequate amount of nutrients in order to meet their body's requirements. And in the case of overnourishment, the individual is consuming an excess amount of these nutrients, which results in the body having too much of it, and it requires that the body find ways to store it or excrete it. To begin with, we will look at the difference between disease-related and societal-related malnutrition. In the case of disease-related malnutrition, we look at the relationship between diseases, treatments for these diseases, as well as how they play a role in malnutrition in patients. In societal-related malnutrition, there is a relationship between the social status of an individual and how much of a risk they are at for suffering malnutrition. The individual status within the community, within their society, influences whether they have an increased or decreased risk of suffering from malnutrition. So, we look at disease-related malnutrition. The definition for this condition is that a disease-related malnutrition is a condition characterized by inadequate intake of nutrients caused by different diseases, as well as the medical treatments for these diseases. In the upcoming slide, we will look at an example of a disease that causes malnutrition. And overall, these conditions cause a decrease in food consumption or eating less nutritious meals. However, it's important that we highlight that it's not solely limited to just diseases that cause this condition. Disease-related malnutrition can also arise due to the medical treatments for said diseases. These treatments may lead to a patient eating less food or losing the ability to eat certain foods that may have the nutrients required by their body, leading to them having a deficit in said nutrients and being malnourished within that nutrient. There are many diseases that can cause disease-related malnutrition. One of which we will look at today is Crohn's disease, and Crohn's disease is a gastrointestinal disease that results in symptoms such as, but not limited to, diarrhea, abdominal pain, and nausea. And this can cause an individual to suffer from a loss of appetite, loss of essential nutrients, and loss of essential minerals. This can also contribute to dehydration. This is detrimental for the patient who is suffering from the disease because as their body is losing its required nutrients through diarrhea, abdominal pain, and nausea, the patient is also suffering from a loss of appetite, meaning that they don't have a desire to consume food, which they need in order to be able to replenish the lost nutrients. This can be very detrimental to the individual, as I stated, and can further exacerbate their malnutrition. Moving on, we look at not just the disease, but we have to remember that disease-related malnutrition can also be caused by the treatments for these diseases. And for our example, Crohn's disease, there are 3 medications that we will look at which are meant to treat this disease, but also they have an effect on the nutritional status of the patient. The first of which is corticosteroids, which can cause weight gain and increase risk of diabetes. The second and third are sulfasalazine and methotrexate. These interfere with folic acid absorption, which is an essential nutrient, and can also cause complications with cell growth. Overall, disease-related malnutrition has a negative effect on patients. Some of these are a loss of appetite, fatigue, an increase in hospital stays or visits, and ultimately with an increase in stays and visits, there's an increase in the healthcare cost, which some people do not have the financial capabilities and the resources to be able to take care of these costs when they are met with them. This can be very detrimental to the patients, to their families, and so on. Next, we look at societal-related malnutrition. Societal-related malnutrition is the relationship between an individual's social status and the risk of them experiencing malnutrition. How their standing in their community affects or influences their chances of experiencing malnutrition. Some of the big factors that play a role into this are poverty, which has a cyclical relationship with malnutrition, marital status, being single, married, widowed, divorced, can also play a role, educational level, where low education is a risk factor for experiencing malnutrition, social economic status, and the place of residency. These all play a role in the overall risk of an individual experiencing malnutrition. As I conclude, I'd like to highlight the importance of the relationship between poverty and malnutrition. In the case of the other factors, there's more of an inverse relationship for most of them. For example, socioeconomic status. As socioeconomic status decreases, the risk of experiencing malnutrition increases. In the case of poverty and malnutrition, there is a more of a cyclical relationship. This means that malnutrition feeds into poverty, poverty feeds into malnutrition, and it goes back and forth in a circle that only makes it worse and worse and worse. So I'd like to use an example to further illustrate this point. Let's say an individual has food insecurity due to limited purchasing power. They are unable to purchase nutritionally dense food. They have to rely on food that is high in calories but low in nutrients. This feeds into health risks, health problems, which feeds into them requiring hospital visits and maybe even hospital stays in order to deal with these health concerns. These hospital stays and visits are costly, which means that these individuals now have to pay off a bill or a debt, which results in them having to decrease the amount of money allocated to things such as food, resulting in an even further limitation on their purchasing power. This is also not even taking into account the fact that with these hospital visits and stays means that the individual may not be working as often, which also cuts their income down even further, which further limits their purchasing power. I think this relationship is really complex and should be assessed more and looked into deeply. Thank you for, I didn't want to end on this note, but this is something that I really think is important and should be addressed. Thank you for coming and to listen. Thank you for listening. I hope we are able to learn something today and that we'll be able to take this and think further upon it, do further research, and move forward as a society, work hard, and pursue some sort of solution that may be able to help people and deal with these problems in ways that we may not have done so far. Thank you.